FMD or hoof and mouth disease is a highly contagious and fatal viral disease. This happens to domestic animals such as cow, buffalo, sheep, goat, boar, etc. And wild animals like deer. FMD is a very serious disease occurring in cow, buffalo, mitten, elephant, etc., especially in milch cow and buffalo. FMD is caused by a very microscopic virus. It is a very fast-spreading disease in animals and affects most animals in a herd or whole village. FMD causes a huge reduction in livestock production as well as adversely affects the export of animal products from the country. This disease causes direct loss of about 20,000 crores per year in our country. Although death from FMD does not occur in the cow, yet the milch animals dry up. Because there is no cure for this disease, it is beneficial to get the vaccine before the disease. On the arrival of this disease, the animal gets high fever. The mouth of the sick animals, the gums, the underside of the lips, on the top of the tongue, between the hooves, emerge from small rash on the area, then slowly they form a large blister. Over time, these blisters fructify and injure them. In such a situation the animal stops chewing. All the saliva falls from the mouth. Animals become lethargic. The animal starts limping because of the wound in the hoof. The production of milk in milch animals falls drastically. These blisters and wounds heal after getting treatment, but in hybrid animals, this disease can sometimes cause death. Acute fever 102 to 105 degree Fahrenheit is usually fatal in young animals. Animals often die of throat disease. To protect them from throat disease, we must get the animals vaccinated before the rainy season. Excessive saliva dripping from the mouth, rope-like, the appearance of ulcers on the tongue and soles that later burst and turn into a wound. A wound between the hooves that causes the animal to limp or stop moving. Due to sores in the mouth, the animal stops taking food and becomes weak. About 80% reduction in milk production. Abortion of pregnant animals and childbirth may occur. Death without any symptoms after excessive fever in calves. Main characteristics are swelling of the feet, around the hoof, short-term fever, wound or maggot wound, mouth drooling, blisters occur on the tongue, gums, lips, etc., which later erupt, excessive loss of production capacity. The affected animal keeps panting even months after being healthy. Even after recovering from the disease, the fertility of animals remains affected for years. There is a possibility of miscarriage in pregnant animals. The feet of the diseased animal should be washed by making neem and peepal blister decoction 2 to 3 times a day. Wound healing cap should be used for quick healing of wounds. Mouth ulcers should be washed thrice a day by mixing 1% alum, 1 gram alum in 100 milliliters water. During this time animals should be given soft and digestible food. Apply boroglycerin 850 ml glycerin and 120 grams borax in the mouth. Make a paste by mixing honey and or ragi flour and apply it in the mouth. Use of antipyretic and painkillers on the advice of the veterinarian, and apply the antibiotic on the animal for 3 or 5 days who has wounds in the mouth, hoof and skin. Apart from this, cook equal amount of rice or ragi and wheat flour, and mix jaggery or honey, mineral mixture, and give it to the animal regularly, and also give protein to your animals. During these tough times of FMD, veterinarians are our heroes in treating these animals. Happy World Veterinary Day. A small token of appreciation to veterinary fraternity standing by you in these tough times. Courtesy Topicure Plus and Oral Topicure SG.